are prepared not only for current but also for future practice. The ethics foundation, critically important, that needs to be interwoven through all areas of the curriculum, not taught separately, and I know that this will be a feature of presentations following this, but integrating the ethics, the values into all areas of the curriculum. The FIP has recently adopted an oath of the pharmacist, which it is encouraging pharmacy schools around the world to utilize in their programs. So every course and every pharmacy experience that the student have should strive to include application and relevance for science, practice, and ethics. Just to wrap up this presentation, how do we know quality when we see it? Well, one of the things that we've tried to incorporate into the global framework for quality assurance of pharmacy education are some quality indicators that are simple to use, easy to recognize, and can be used by academic institutions in their own self-assessment of quality. I realize that you're not going to be able to read that screen, so I would encourage you to go to the FIP website, have a look at the document, and in each of these areas, each of the pillars, we have simple indicators of quality, what to look for. And I would encourage those of you who are involved in academic institutions to make use of this document, make use of the indicators as part of your own self-assessment and quality improvement efforts. So the document contains indicators for context, structure, process, outcomes, and impact to help you recognize quality where it exists and where perhaps there are areas for improvement to focus your attention and your priorities on those areas. So thank you for your attention. I hope this sets the stage for our next two presentations that will follow, and at the end of our combined session, hopefully there will be some time for questions. So thank you very much for your attention. As chair of this session, now it gives me, it's my privilege to introduce our two next speakers, continuing in the theme of education. And Professor Christine Yalowski, who you've already met, many of you would have met her as she presented her keynote address yesterday evening. I'll give a very brief introduction to her, as you've had information about her bio already, but I know not all of you were here last night. Christine is the Executive Director for Applied and Experiential Education at the University of Minnesota's College of Pharmacy, and we know that the University of Minnesota was one of the cradles of pharmaceutical care. If you want to talk about impact of an educational institution, look at the University of Minnesota, the number of leaders that have come out of that institution, the number of innovations that have come out of that institution. So certainly great credentials in that regard, Christine. Also, as we mentioned yesterday, Christine is the current president of the American Society of Health System Pharmacists. Very strong element of her work and leadership roles that she's played in the profession in the United States for a number of years now have focused on clinical and operational performance improvement, medication use improvement, and patient safety. She's also been a very strong advocate for expanding the roles and promoting the roles of technicians, students, also residency training, and expanding the roles and scope of practice for pharmacists. ASHP for many, many years has taken a leadership role in residency training, and this is going to be the subject of Christine's presentation, and I would ask you please to join me in welcoming Professor Christine Yalowski to the stage. Thank you, Christine.
Thank you, Mike, and I will echo his comments. I really do appreciate being here. It's a lovely, lovely area, and I left snow, which I do not have a picture of, but I do have piles of snow between my dogs and my children being home having to move it. I also want to say kudos to the organizers of this conference, because as we go through the day, we're very much supporting each other's talks. We're talking about leadership, we're talking about vision, we're talking about where to go. There's some extremely practical tools, which is something I'm thrilled because I can take home. As I said, right now I work at the University of Minnesota in the College of Pharmacy, but I've been in hospital pharmacy and health system pharmacy practice for over 25 years. I have a residency. Right now, we call them a PGY1 and a PGY2, but during the time that I went through, we didn't have those monikers. But I'm very passionate about residency training. And as Mike said, we're bringing our students out to be practice ready. And what the residency does is it takes them to that next level. Because we do have the training within our formal education programs, but we need to help our students figure out how to apply that, and that is the role that we have as residency training. I don't have a disclosure slide, but I'm actually here on behalf of ASHP, so my talk will be very much slanted to the work that we're doing at ASHP. But as I said, I'm very passionate about residency training. I've been involved with residency training throughout my whole career, so you will get a little bit of my personal slant on this. So I'm going to talk about our residency training objectives, the roles, and some of the general requirements that we have. I have a couple slides on the residency process, so how you get a residency program started. I'm going to talk about the value of the residency training, both for the students, for the site that they're training at, and also for our profession. And I won't go in depth into what we're doing as far as international residency accreditation, but I'll touch on it as I move through my slides. So what are we even talking about? We're looking at specialized training and the application of the knowledge. So what students have done in school and how do they take care of our patients. And these are under controlled environments, but our residents are pharmacists. So they have passed their licensure exams either early on in their residency program or prior to going into their residency program. So legally, they can perform as pharmacists. But we work with our preceptors to oversee the work that they're doing, to make sure that they not only take those skills and the knowledge that they learned in school, but are also able to apply it to their practice setting. And in a structured manner, we give them feedback. But not only that, they're exposed to different facets of pharmacy practice that they don't necessarily have exposure to in their training, or they only learn about. That might be the leadership components that we've spoke about. It may be getting more involved within administration, within management. They understand protocols, but in a residency setting, they actually work side by side with other pharmacists, with other healthcare professionals, to figure out not only the steps involved in creating a protocol, for example, but how do they bring it to life? How does it get into our automated electronic medical record systems? How do we move these forward within the structure of our pharmacy and therapeutic systems? What are some of the landmines and the pitfalls? And those are some of the experiences that we want our students to have as they move forward. As far as ASHP's role is, we are an accrediting body. We accredit not only pharmacy residency programs, but also technician training programs as we move forward. We have a commission on credentialing, and seated at the table are many, not only the ASHP Board of Directors, but many other pharmacy organizations within the United States. So as we're moving forward, we have input from the profession. Input as we look at the standards that we're developing, input as we're looking at the process, and also this review committee looks at our accreditation reports. So when they sit down, they actually review the summary of reports from probably 300 or 400 sites every 6 months to determine if we should move accreditation forward at each of the individual sites. As we've looked at expanding residencies, we've also broken off that technician training component, and we're separating out our international pharmacy accreditation components. And part of the reason for that is the growth, because we're seeing more and more of a demand in all three of those areas. So what we're finding is that we can focus on each of the individual areas. And now, for example, for our international accreditation programs, we're bringing in international experts to help us review the standards that we have to promulgate them. We are a body that recommends our standards, and as a member of the Board of Directors, I'm part of the body that approves the standards that comes forward from our Commission on Credentialing. During the accreditation process then, We have the accreditation standards, and our surveyors will go out and compare the sites against the established standards. One thing that's really nice is as they're going out to all of our sites, they can look at best practices and recommend those to our hospital, our health system, and our sites. But the flip side is they also identify best practices, which they bring back and can share with others. So that's one of those nice sharing things that we have is, as pharmacists, that we do share easily and we share well. And as one of my mentors would say, that we will steal shamelessly as long as we give full credit to the source. And so we are very happy to use what others have developed. So we have 2 levels of PGY1 and PGY2, 2 levels of residency training. For PGY1, usually students complete this after their first year of pharmacy school, after they've completed the year, so the first year out, but not necessarily. This is really meant to build on the knowledge and the skills and the training they've had from pharmacy school. During the program, there's a lot of general competencies, and these are requirements of every residency program, regardless of the setting. So this could be a hospital setting, it may be an ambulatory care setting, they might be in a pediatric hospital, a hospital that focuses on oncology services, but each resident is required to complete these standardized training. In addition, they can pick specific objectives that they want to focus on going through. So that's one of those standardization areas that we want to assure if someone comes out and they say they have an ASHP accredited residencies. We do have a standard process that you as an employer, you as a coworker, understand what that resident went through in order to achieve that residency program. At the second level, not only a PGY2 not only builds on what a student or the resident has learned during that first year, but they usually specialize. So that would be additional training, whether that's in cardiology, it may be in drug information. It's usually either a clinical area or possibly an administrative area, where they can focus more on a single practice setting. So they're looking at increasing the residents' knowledge and skills in a given area. Some examples that they have here are medication therapy management and clinical leadership. And we're seeing, for example, a lot of the directors of pharmacy and managers of pharmacy have gone through a PGY2 program with the focus on administration. So they can start, I think that was an earlier question, so they can start to look at some of the skills that are needed and how to apply those skills in the general areas. We're seeing a lot of our PGY2 residents acquire board certification very early in their career. And this is something that we're seeing sets them apart from their competition. And as our standards are developing, for a program director for a PGY2 residency program, if there is a board certification program available in that given area, then we are requiring the residency program director to have certification in that specific area. So as we're expanding certification programs, such as BCPS, we are supporting that by requiring our preceptors and our directors to have those skills. Some of our standards and program requirements. We have a general commitment to professional competence. We want to develop a professional environment for our residents that's conducive to their learning. And in a way, not only conducive to their learning, so they learn how to learn. And they also learn how to teach. Because that is an expectation as our residents go out that we give back to the profession. And one way to do that is for them to teach during their residency program and when they get out, whether that be pharmacy students or residents or other healthcare professionals. So that moves also to the specific program's educational goals, because each of our programs are a little bit different. They have the similar competencies, but if you go to a university hospital, for example, your exposure, some of your goals might focus more on research, as we heard this morning, or may focus more on some critical aspects versus a residency program in a general hospital. So the resident coming in needs to understand what the program's goals are and do they match. We have a systems-based approach to training. So we are not siloed as pharmacy. We are not looking only at the hospital. We understand our patients move in and out of the hospital, and we need to work across care settings, and we also need to work within our disciplines, various disciplines of care, to assure that our residents are trained to understand the various steps and to be able to provide that care in the future. And we have the residency standards that we require, and we also want to make sure that the sites that we have our residencies at meet our general requirements. So when a residency surveyor goes in, they're not only looking at the process for the residency itself, but they're also looking at the service components and the delivery and the care that's provided generally by the pharmacy department. So is the site able to provide the level of training, provide the services, provide the direction and the settings that a resident needs to be successful? Within the United States, after you go through an accreditation survey, you are granted either a 1-year, a 3-year, or a 6-year, which is a full accreditation. And this is based on how a site is complying with the residency standards. About 25% of our graduates right now enter hospital practice. And to put that as a number, we're looking at over about 14,000 graduates in the United States. And that number, as far as 25% going into hospital or health system practice versus community, has actually remained relatively stable. We're seeing some expanded practice settings over the course of time, but we have about 20 or 25% consistently going into hospital practice. And we have 16% that are going into residency programs. We've seen a big growth in our program. The numbers list a little over 1,000 programs themselves. We probably have about 2,800 positions, residency positions for PGY1 within the United States. This one says, for the PGY1, PGY2, so over 3,600 for both of them. One of the interesting things, though, is our demand. We have over 4,000 students that are looking for PGY1 residencies, and we don't have that many available at this point in time. So that is one of our goals. As I stated last night, we do have a target goal that our pharmacists practicing in our hospital and healthcare settings will have a residency. And our target goal date is by the year 2020. But we do have a gap. And we know that within our systems, is we do have a lot more students coming out that want residency programs than we can meet the demand. So that really is an issue that we're struggling with in the States. One of the answers, obviously, is expansion. And some of the reasons that we have up for expansion and how we're expanding is we do have very complex medication therapies. And part of the target for the residency programs, part of the demand for residents, part of the need for residency training is to help our students navigate our complex medication systems and our medical systems. We're looking for that medication expert. And we talked about leadership this morning. And that's one thing that at the University of Minnesota we have incorporated into our curriculum throughout. Not a special leadership program, but we work with our students so they understand the role of the pharmacist in every situation, that they are a leader. And this leadership gets down to when they're talking to the patient and being able to convey the information that they know and to help direct that patient all the way up to the formal leadership level. So that is something that we have ingrained within our system. And with the residency requirement, it does take it to the next level. We are seeing that our employers are requiring residency training. Some sites are able to accomplish this, that they only hire residency-trained pharmacists. Other ones, we're not there yet, just because we don't have the number of residency-trained pharmacists coming out in the market quite yet. But that is a standard that we're seeing more and more. As I mentioned, our students are demanding it. Part of the reasons our students are demanding it is it will help them stand out from the competition. But I think they also understand that this is something that they need in order to work in some very complex environments. And from our side, from the profession, we are saying that we need residency-trained pharmacists. So some of the factors that we have influencing our training is we are seeing changes in our education system and in continuing education. There are the advances in science and therapies We are seeing development of practice standards. And in order to meet some of our practice levels, we need to have that background in training and experience. Supporting residency training is the expansion of our residencies. We've had several conferences to look at the quality of our residencies, to look at the number of our residencies, and how do we support expansion. And then with the expansion is we also have leadership. Leadership that is really setting the bar high for this level of practice. These are just some examples, and it might be hard to see, but I'll refer you to our ASHP Research and Foundation website. One of the things that we try to do is highlight excellent programs. And these are some of our sites that have won our Pharmacy Excellency Award for their residency programs. And this is, again, where we do share, because we want to show the successes of some of our programs, and we want to help others to identify what we're doing well. We also want to help others to identify what you're doing well. So when you look at some of the experiences and some of the things that others are doing, you're going to recognize that your programs are doing some of the same things, or maybe some different things. So hopefully we encourage people to start to share some of the work that they're doing. Some of our steps to training, because that's one of those pieces that how do you even start? That's one thing that ASHP has done, is that we have put this on the website. Where do you even get started with a residency training program? We do have our residency training standards that are available on the website, and we do have our international residency training standards that are on the website. If you're looking at expanding or starting a residency training program, it's important to consider various steps, and usually this is about a 2-year process, but looking at your infrastructure. What programs do you have that would support residency training? Who is going to train the residents? Because you can have someone who's very passionate about residency training, but that is not the only trainer that's there. You have all the pharmacists that are in your department. You may have other health professionals that you want to get involved in training. And they have to be on board with having a resident. And this is very similar to having them on board with having students, because residents are a lot of work. We have made a commitment to their future. So that is a lot of our responsibility when we're bringing in residencies, is that we will have a commitment to training our pharmacists of the future. So we need to make sure that we have the people in place to do this. And then also, what are they going to do for the year? So lining up the processes, lining up the activities, lining up their rotations, and this may be done individually and customized, or you might have in mind where you want the residents to go. But making sure that you are able to fulfill the requirements of the residency. So that's one of those background steps that need to be done. We do have an Are You Ready tool. And this is to look at, have you gone through the steps of the residency? So these are one of these practical tools that we know if someone wants to move forward in expanding practice. This lists some of the steps that you can take to make sure that you have done your homework, that you have your sites in place. As I said several times, we share and share alike. And our residency programs are all a little bit different. So I would recommend that you find one that you would like to emulate. Sometimes you can even take their manuals and their worksheets